Hello, welcome to the Early Childhood Education and Care System Overview Foundational Training. To make the best use of this presentation, you will need the ECEC Program Overview document. If you have not downloaded it yet, please do so now. Also, please note that there will be opportunities for you to stop the training and reflect on what you've learned. So you might want something to write on nearby. This Early Childhood Education and Care System Overview training is the first in a series of 7 foundational trainings that will be available to you. It will be followed by Racial Equity in Assessments and Planning, Community Systems Development Overview, Early Childhood Data and Asset Maps, Parent and Community Engagement, Workforce and Facilities. We recognize that participants are coming from various backgrounds, and for some, the information shared today might be new, while for others, it may not be so new. For that reason, I want to stress that today's training will provide a broad overview of the early childhood education and care system. It is meant to be foundational, serving as a baseline for learning. There will be a list of resources at the end of this training for those of you who want to explore more in-depth information. We have 5 objectives for today's training. The first is to recognize the importance of early childhood education, to understand the need for racial equity in early childhood education and care, ECEC systems, learn how the early childhood education and care field has evolved over time, and build knowledge of early childhood education and care programs and services. Please note throughout this training, I will be using the terms early childhood education and care and early childhood education interchangeably. A little bit about who we are and what we do. We are the Community Systems Statewide Supports, or CS3 team at Illinois Action for Children. We provide training and technical assistance to local early childhood collaborations and to regional councils throughout Illinois. Our aim is to ensure that local communities and regions are working to help children prenatal to 8 receive the support they need. We build the capacity of community collaborations and regional community systems to continuously improve local and regional early childhood systems. We'll be using core components of the community systems development process to support the work at the regional level. You will learn more about community systems development in training 3. One of CS3's core values is equitable outcomes in all communities is worth pursuing. As you work within your region, we encourage you to approach your work with the racial equity lens. We will be talking more about racial equity later in today's training, as well as in training 2 of the series. Let's look at how CS3 defines racial equity. CS3 defines racial equity as both an outcome and a process. As an outcome, we achieve racial equity when race no longer determines how one fares in society, when everyone has what they need to thrive no matter where they live. As a process, we apply racial equity when those most impacted by structural racial inequity are meaningfully involved in the creation and implementation of the institutional policies and practices that impact their lives. Please take a moment to pause the training to reflect on the following question. What words or phrases stood out to you from CS3's definition of equity and why? All right, before we get started, I want to share the agenda for the rest of the training. We've completed the welcome and introduction portion of the training. Next, we'll cover the importance of early childhood education, racial equity, birth to 5, how did we get here, early childhood education and care programs and services, and then we'll have a recap and share some resources. Please pause the training to think about the following question. What percentage of a child's brain do you think is developed by age 5? Let's learn a little more about brain building. The video we are about to watch is from the National Society for the Prevention of Cruelty to Children, a child protection charity in the United Kingdom. As you're watching the video, think about what stands out to you about brain building.
From peekaboo to story time, these all help build the brains of growing children. Parents, caregivers, and other important people in a child's life are doing this together every day. People like nursery staff, health visitors, grandparents, and family friends. Everyone can provide the materials children need for a strong brain. Just like building a house, building a brain is an active process that starts in our earliest years, from the ground up. This lays the foundations for future learning and growth.
Our earliest years of life are a time of incredible opportunity to build strong brain foundations. During our early years, a child's brain circuits are particularly sensitive, and seemingly small actions can make a big difference. From our earliest months of life to around 3 years old, children's brains go through a period of intense growth. During this period, there's a peak in the development of what we call synapses, the connections in the brain. Over time, connections used more often are strengthened, and those that are used less are pruned away. So only those most suited to children's environment and experiences remain, providing the foundations for future relationships, learning, and health.
Later, experiences and
At this time, pause the training to reflect on the following question. What stood out to you from the video? The quality early childhood experiences and interactions that we just learned about in the video can yield a return on investment. Research by economist James Heckman showed that for every dollar invested in quality early childhood programs, they can yield a return between $4 and $16. Some of the benefits we see are an increase in high school graduation, college matriculation, and economic development and personal income. There is a decrease in special education remediation services, dependence on social welfare, and crime-related costs and incarceration rates. Research is critical to the early childhood field because the data can be used to advocate for funding for quality early childhood programs and services and inform program practice. Here's a chart showing the economic impact of investing in early childhood education and care. It shows the earlier we invest, the greater the return. To recap this section, we watched a video sharing the importance of quality early childhood experiences to support the development of a healthy brain and learned that investing in quality early childhood programs yields a return on investments. I want to point out that it's important that those investments in quality programs and services are targeted and allocated equitably to improve the outcomes of children who are negatively impacted by inequities. Now we're going to focus our attention on racial equity. This bar graph was taken from the Center for American Progress. It shows the quality of interactions children have with preschool teachers based on the Arnett Caregiver Interaction Scale. The scale measures the caregiver's interaction with children in pre-K settings by observing aspects of the caregiver's teaching style, such as emotional tone, discipline style and responsiveness, or detachment to students in the classroom. The lighter blue bar indicates lower quality interactions, and the darker blue or navy bar indicates higher quality interactions. When children are exposed to high quality interactions, just like the ones we learned about in the brain development video, research has shown that they are more likely to be successful later in their academic career. So here we see that African-American children specifically are much less likely than children of other races to be in programs that score highest on caregiver sensitivity and are much more likely to be in programs that score the lowest. Please take a moment to pause the training to reflect on the following question. What are your thoughts about this graph? And what questions does it raise for you? Here's another slide that highlights racial inequities. This is an infographic from 2017, Racial Inequities in Preschool Discipline. It shows there is one Black child in preschool for approximately every 2.3 white children in preschool, yet there are 3 Black children with multiple suspensions for approximately every 1.5 white children with multiple suspensions. Exact numbers are the following. Black preschoolers account for 47% of those suspended, even though they represent only 19% of enrollment. Disproportionate preschool suspensions are the result of adult behaviors. They arise from implicit racial biases, which impact teacher expectations. Preschool suspensions cause a loss of vital school time that contributes to the achievement gap. Young children who are expelled are suspended are as much as 10 times more likely to drop out of high school, experience academic failure and grade retention, and have other negative experiences related to school compared to students who are not expelled or suspended. In 2017, Illinois passed legislation, the law was enacted in 2018, aimed at ending the practice of expelling infants, toddlers, and preschoolers from their early childhood programs. Based on the 2021 report from the University of Illinois at Chicago, 3 years after the legislation was passed, emergent data shows that programs still find other ways to exclude children under 5 for behavior issues. The law requires publicly funded programs to exhaust every resource available to meet the behavioral needs of a child before expulsion. If a center cannot meet the needs of a child, the provider must work with the family to identify and transition a child into an alternative care setting and document and provide data around the decision. However, Black children continue to be overrepresented among children who are formally expelled or transitioned from programs in Illinois as they are in national data. Take a moment to pause the training to think about the following questions. In what ways do you think racial inequity impacts early childhood education and care in your region? And then what actions can help promote racial equity in early childhood education and care in your region? Here are some ways racial inequity impacts early childhood education and care and ways to address it. Underfunded programs and services, undervalued and underqualified workforce, limited or difficult access to services, incomplete early childhood data or lack thereof, uneven quality in programs and services, family voice and shared power ignored. Ways to address these inequities: advocate for policymakers to increase funding, capture data to identify gaps in services, improve the quality of the workforce by increasing teachers' pay, affordable access to training and education programs for teachers, and families are decision makers. You might have had some of these items on your list. Okay, let's continue. Birth to 5, how did we get here? During the 19th and 20th century, there were basically 2 early childhood tracks: programming for low-income families and programming for wealthy families. Programming for low-income or poor families were created to support mothers going into the workforce. The focus wasn't on cultivating the developmental needs of the child. The focus was having a place to bring children while their families worked, versus program for wealthier families that was focused on supporting the child's developmental needs. Black families during this time were often not allowed access to early childhood programming. As a result, some Black families and communities came together to create their own programs that were known as day nurseries. I want to point out the picture you see here. This picture was taken in the mid-20th century where Black children were served in Evanston, Illinois. Here's a timeline of early childhood education and care milestones. As you can see, it starts with 1941. However, the history of ECEC didn't start in 1941. So we're going to look back to see, how did we get here? The inequities in the current childcare system are the result of a long history of discriminatory ideas, policies, and practices rooted in both racism and sexism. If we were to go way back, Black enslaved women bore the burden of domestic work by providing childcare both as forced labor and underpaid workers before and after the Civil War, which at times made it difficult for mothers to even care for their own children. In 1938, the Fair Labor Standards Act intentionally excluded domestic workers, which prevented many Black women from receiving key provisions and protections such as minimum wage and overtime eligibility. We can see the impact of those unjust policy decisions today. Early childhood educators are among the lowest paid workers in every state. Childcare is generally undervalued and poorly compensated because it is considered women's work. Women make up the majority of the early childhood workforce, with women of color disproportionately represented in early childhood settings relative to their population numbers. Black and Hispanic educators make the lowest wages among early childhood educators, and systemic barriers reinforce these inequities. So now that we've provided a little more context, take a moment to review the early childhood education and care milestones. The text in purple represents federal advancements, and the orange text represents Illinois or state advancements in early childhood. Take a moment to pause the training to think about the following question. What do you think contributed to some of the progress made in early childhood education? In this section of the training, we will have a high-level overview of early childhood education and care programs and services. It's important for anyone working with regional councils or family councils to understand the early childhood landscape. Here is an Illinois early childhood education and care overview graph. This graph mainly shows how programming is funded. It shows at least 10 different funding sources and multiple administrators for myriad programs and providers. Early childhood professionals, such as childcare providers, teachers, and home visitors, receive federal and state funding to provide a variety of services to children. But these services are only available through a complex maze of funding streams and government agencies that are difficult for anybody to navigate. At this time, take a moment to pause the training to reflect on the following questions. What is one word or phrase that describes your reaction to this diagram? And then what observations can you make? We just looked over a very complex graph of early childhood education and care systems in Illinois, but here is a breakdown of how the programs and services are funded at the federal and state level. Federally funded programs and services, Early Head Start and Head Start, Home Visiting, McV. State funded programs and services, Prevention Initiative, Preschool for All and Preschool for All Expansion, Early Intervention, Early Childhood Special Education, Home Visiting, IDHS, Child Care Assistance Program, CCAP, and then there's Accelerate, which is Illinois' quality rating system. Early care and education programs are typically provided in these settings. Community-based center is any facility that regularly provides child care services less than 24 hours a day to 3 or more children, with children ranging in ages from birth to 12 years old. Child care homes, sometimes referred to as family child care home and group child care homes, are both child care arrangements located in a residence. Child care home caregivers may only care for up to 8 children, including their own, or up to 12 with an assistant. Group child care home can provide services for up to 12 children plus 4 additional children with an assistant. Family, friend, and neighbor care is provided in a child's or caregiver's home by a person who is a relative, friend, neighbor, babysitter, or nanny. The provider may care for 3 or fewer children, including their own, or children from one family. Family, friend, and neighbor care is also license exempt, and we will review child care licensing on the next slide. And then there are school districts. Qualifying school districts provide publicly funded programs and services for children birth to 5 across Illinois, and then home visiting, where services are provided in a child's home. Child care or daycare is the term most generally used when we're referring to the supervision of a child or multiple children at a time. Child care services typically fall under 2 categories: licensed or license exempt. To become a licensed child care home or center, Illinois Department for Children and Family Services monitors the staff and child ratio, staff training and background, physical space, indoor and outdoor, health and safety requirements, and nutrition. This isn't an exhaustive list, but these are some of the main standards providers must meet to become licensed and maintain licensing. A center or home may be exempt from licensing due to school age only services, the number of children in care, and school or religious affiliation. Programs that serve children 3 years and older and are operated by public or private elementary or secondary schools or by accredited schools registered with Illinois State Board of Education, ISB, are also license exempt. We now like to give you some time to get to know about the different programs by inviting you to participate in the ECEC program overview hunt activity. Over the next few slides, you will find information or descriptors of the various programs found in the ECEC program overview document. If you have not downloaded it yet, please take the time to do so now. Here's an example before you proceed with the activity. What programs was designed to expand voluntary evidence-based home visiting to improve the outcomes for pregnant women and families, particularly those considered at risk? The answer, Maternal, Infant, and Early Childhood Home Visiting Program, MCV. As you go through the following slides, please pause this recording so that you may look for each answer. When you resume playing the recording, the correct answer will appear. We hope that the ECEC program hunt helped you familiarize yourself with the programs available to children and families in Illinois. Okay, let's recap what we covered today. We learned about the importance of early childhood education, the need for racial equity in early childhood systems, how the early childhood field has evolved over time, early childhood education and care programs and services. Finally, as I mentioned at the beginning of this recording, here are some resources for those of you who want to dig a little deeper into the early childhood care and education sphere. First, we have the Early Childhood Education and Care Overview handout, which you will use to complete the activity hunt. We have the Partner Plan Act website, IDHS childcare website, and the Accelerate website. Thank you so much for your time today. Enjoy the rest of your day.